Welcome back. This is Global Health, and I'm Gail Fraser. And this week's lecture is about immunization. This is Unit 13. And we're also going to be talking about universal access to health care. So our topics will include the expanded program for immunization, universal immunization program. We're going to be talking about some global health champions or public health professional profiles. And then the thing that is such a barrier often in low resource settings, like some sub-Saharan Africa or even some poor countries in Latin America, is the financial support for global health initiatives and vaccine development. As a matter of fact, much of the Bill and Melinda Gates Foundation money, about half of it actually goes to developed countries where they're working on vaccines. So much of the research is being completed in France. So they get a good bulk of the grant money. There are daunting challenges of vaccinating all children. So we're thinking about universal access. You're talking about vaccinating all children in the world. And it's an enormous task and requires a great amount of resource, both human health professional resources as well as money for the vaccine itself. But we have to support the World Vaccination or Immunization Week. The World Health Organization sets international guidelines for prevention of vaccine-preventable diseases through the expanded program of immunization. So the EPI, extended as well as expanded program of immunization. Under the United Nations organizations, it's been established that we have a global epidemiology surveillance system that's very sophisticated. The global framework for immunization monitoring surveillance was developed by the World Health Organization. Again, it's so important to take care of some of the health conditions by vaccine-preventable diseases. And in concert, they work with Center for Disease Control in Atlanta. The Center for Global Health, or Global Immunization Division, you can see Rebecca Martin is the head of that division, and then how that's organized. So you have disease eradication as well as strengthening immunization programs. So routine immunization, surveillance of immunization records, strengthening the quality and use of immunizations. These are all topics that we are talking about today. And you can see World Health Organization is divided into the Afro division, Euro, the EMRO, which is Eastern Mediterranean, CIRO, which is Southeast Asia. You can see the different types of divisions of World Health Organization. WHO measures progress for immunization goals. By controlling vaccine-preventable diseases, we are hoping to have a universal or global EPI. Strict adherence to required reportable and notifiable conditions is important. So, for example, influenza is a reportable illness. So the high number of cases of swine flu that they're experiencing in 2015 in India is a notifiable condition, just like any other Ebola, different types of HIV is a reportable condition. So these are all things that are required to be reported to World Health Organizations through the national organizations. The Centers for Disease Control, each nation has its own Center for Disease Control. When I'm referring to CDC, I'm talking about the U.S. Centers for Disease Control. And we're talking about the vaccine-preventable illnesses, which are then reported to the World Health Organization. Over the whole world, the United Nations and WHO has been successful in giving advice about the expanded program for immunization, which we've nicknamed EPI. The expanded program for immunization was established in 1974, so that's a long time ago, and it really was the intention to provide universal immunization for children. That was our focus at that time. The global health goal is to immunize all infants and children against most vaccine preventable illnesses. So we're talking about measles, mumps, rubella. We're talking about tetanus. We're talking about pertussis, which is whooping cough. So these are the basics. Polio. Right now, they're working very hard in Nigeria to get worldwide coverage of immunization against polio. EPI is to make sure that all children in every country are fully immunized by the World Health Organization and UNICEF, which is an organization that focuses on children's health within every district. Supplemental immunization activity, or SIA, it reduces the number of children that are actually, if they weren't at school at the time when they gave the immunizations, that they would catch them the next time. So supplemental immunization activity would be return visits to these same locations. There are 6 vaccine preventable diseases that they focus on, and initially they were targeting tuberculosis, polio, measles, and the DPT, which diphtheria, tetanus, and pertussis. In Bangladesh, you can see the huge difference it makes. The death rates here in the red bar is dramatically going down over time as the immunization rates go up. And Bangladesh, along with India and a lot of countries in Asia, are severely affected by just outreach, just the numbers of people in poverty that actually don't routinely go for health services that were reached through schools or neighborhoods or all different types of health initiatives. You have a schedule of immunizations. Again, in the United States, they recommended you have shots against influenza for the young children as well as older. So I get my flu vaccine because I'm an older person. But you can see these are the routine schedules here. So tetanus, you need to have that every 10 years, even as adults. The polio campaign was kicked off, and we used to get an oral live vaccine. They no longer use the live vaccine because there were actual cases of severe polio that was passed through water systems and between family members. So they no longer use the live vaccine that was very commonly used. This is a live vaccine picture. And as I mentioned, Nigeria, they've got a huge campaign right now. There's only one place in the world that still has live type polio, and that wild type, I should say, is in India. And again, the density of population in India, the outreach to try to immunize everyone is a huge effort. I know that where I'm living here in the United Arab Emirates, the government here just donated $400 million to the Bill and Melinda Gates Foundation in support of eradication of polio. Smallpox was declared eradicated worldwide in 1980, so that's actually not so very long ago. Many of you weren't born at that time, but I know my oldest daughter was born in 1979, so she's 36. She's having her birthday this week. And so 1980, when you're looking at health interventions, wasn't really that long ago. There was hope that polio and measles and other diseases of childhood would also be eliminated. So as I mentioned, the big push is for the eradication of polio right now. Measles elimination in Latin America. So this is an example. You can see that in 1990, right across, when they started to do immunizations right away, the number of cases dropped. Right now, there is a lot of people that have gotten less worried about immunizing their children. And so a lot of kids, even school-age kids, can attend school that have not had their measles immunization. The problem is, of course, as the number of children increases that have not been immunized, excuse me, there more and more children could potentially have measles. And so that's why we're in the United States right now. We're having a huge increase in the number of cases of measles. It's not because the measles vaccine is not working. It's because many families have elected not to have their children immunized. And so when you get a big enough ratio of 20% or so of children that are not immunized against the certain conditions, there's a greater chance and risk, and we're seeing exactly that, a huge increase in the number of cases of measles, also pertussis, whooping cough, and it is simply because people have failed to have their children immunized. You can see imported cases from measles, so you have people traveling to Latin America from Africa, from Europe, from Asia, so they've even tracked these different cases down. This is important for epidemiology of any health condition. And then, of course, bioterrorism. This is something that the U.S. is investigating. I know European countries are also very concerned of bioterrorism, using these different highest risk and public national security category A conditions, trying to use, say, Ebola virus or some other type of infective agent for bioterrorism is something that's of great concern. Smallpox would be one of the things that they'd be worried about, because many of you have never been immunized against smallpox. I'm old enough that I actually had a smallpox vaccine, but we've eradicated it. There have been no new cases. And if there was a chance of using a vaccine, preventable disease, as one of these bioterrorist infections, it would be very frightening, because most people that are under 30 years old wouldn't have been vaccinated against smallpox ever in their life. Category B, you see the second highest priority, where they have the disease could cause a low number of deaths. And then category C, these would be emerging pathogens. So they're types of health conditions that are brand new. Most every year we've got a brand new different variation of the influenza virus. So this would be an emerging pathogen. Category A, of course, would be the highest risk. So examples would be anthrax, botulism, pneumonic plague, smallpox, as I mentioned. Tularemia is another health condition that could be used, in Ebola. Category B, the examples would be rincon toxin brucellosis, which is a condition of cows, Q fever, typhus, or food or waterborne pathogens. And category C, they would be the Nympha virus, hantavirus, yellow fever, or multi-drug resistant tuberculosis. So these are the conditions that people are very concerned about if they could be used as weapons. So the expanded program for immunization, it has an important component of practice to ensure that the vaccines reach the people, to ensure universal immunization through all levels of the vaccine. So preventable diseases that are low infectivity, as well as ones that are higher. For example, chickenpox is something that many people are immunized against now, whereas I was allowed to have chickenpox. They didn't have a vaccine, and that vaccine is quite expensive. So it's about seeing how they can be reached. School entry laws, linking immunization to when women bring their children in for child services by reducing their costs, visiting homes and neighborhoods and orphanages. So again, there are different strategies for spreading, making sure EPI is effective, exchanging information to healthcare providers. Again, state of immunization worldwide, you could see that the number of people that have the DPT is very high now around the world. For example, worldwide, measles deaths have fallen 74% between 2000 and 2007, but now they're on the uprise because more cases are appearing. So global disease surveillance is within a network. You can see the different components. So World Health Organization, epidemiology, and right round where you have global World Health surveillance, regional country, and then national programs, of course. So we're going to lead on to the part 2. This is Global Health, and I'm Gail Fraser. We were just going on to Unit 13, Part 2, where we're going to be talking about Global Health Champions. And I want to encourage you, I've supplied, with this unit, we have a list of the Global Health Champions with their email addresses. And I want to encourage you to actually contact some of these people. Call Molly Hartridge or Diane Moroff, and they would chat with you on Skype. They would share information about what their careers have taken, where they've gone and the things they've done with their career. And I think you'd be very interested to speak to some of these young professionals that I've worked with in the past. One of them was the Global Health Champions, Nabila Wasif, and her husband Mumtaz, and she is a Global Health Champion. She spent her whole career in working with the team that is responsible for trying to develop a vaccine for HIV. She's originally from Egypt, and she worked for the U.S. National Institutes of Health, and they've made a huge contribution. So this is her email address, and she is an international research infectious disease researcher. She led the clinical trials for HIV/AIDS vaccine development, and so this is a huge effort that's still going on. There's also Thomas Ritchie. I had the privilege of working with Dr. Ritchie in Indonesia when he was still with the U.S. Navy, and at that time we were doing the clinical drug trials for different types of anti-malarial drugs. And I learned a lot from him as well as the rest of his team. And he is a global champion. He recently retired. And again, he was the head of the malaria department for the U.S. Navy. And you think, well, why is the U.S. Navy doing research on malaria? Well, it has a lot to do with military readiness. If the Colombian Army is deployed in different parts of southern Colombia, there's a good chance that they might be exposed to yellow fever or malaria or other dengue, chikungunya fever, different types of infectious diseases that are vector-borne. And so they really take the lead on trying to find vaccines for these different types of health conditions. Look at the idea of going to Central Asia, Kazakhstan, sorry. And again, all these Uzbekistan, Tajikistan, Kazakhstan, these are all countries that are part of just south of the former Soviet Union, near China. And one of the Global Health Champions I wanted you to be able to contact is Martha Haddock. And again, her parents are good friends of ours. We lived together in Indonesia, and I was really happy that Martha decided to join the Peace Corps, and she finished her bachelor's degree at SMU in Dallas, Texas, and then she accepted a 2-year posting in Kazakhstan. But right before the 2 years was up, she was actually evacuated because there was an outbreak of civil war, and she along with other Peace Corps volunteers had to be moved into the military compound and then airlifted out because they were worried that they might be injured in the Civil War. So there are risks involved when you work in international locations for whatever purpose that you're there. And so here we are, you can see better where Kazakhstan is, in proximity to India, Saudi Arabia, Mongolia here, of course, and China. Another Global Health Champion, or I should call her a future Global Health Champion, is Amanda Sunny. And again, she would welcome you to email her, Skype her. She is the same age as you all, basically. She just graduated from University of North Texas Health Science Center in Fort Worth, Texas. But she has developed a safe water pilot project that she wants to carry out in Nigeria. She's originally from Nigeria. She still has a lot of family members in the southern part of Nigeria, and I'm really excited for her and willing to work with her team and try to support her as she's trying to figure out how to be successful in promoting this safe water initiative. So you can see this is the southern part of Nigeria. So here's Nigeria, of course, right here. Niger is here, Burkina Faso, Chad. Cameroon is just south. Ghana. These are names that you've heard a lot in the news about because this is West Africa because of Ebola. And here is the southern part is where she's interested in starting this initiative. But what's great is that here's her email address. She's willing to talk to you about her plans for the future. It kind of gets you excited about working internationally. And she has been selected to represent University of North Texas at the Health Summit in Abuja, Nigeria, just this summer. So she's really excited. I would welcome you to watch this video, Childhood Immunization. So it's in your video library for you to examine. So let's just summarize our presentation so far. The extended, expanded, so it should be EEPA. Okay, well, never mind. So Extended Expanded Program for Immunization is a great support of global health, and the goal is to immunize all infants and children against the most common vaccine-preventable diseases. So those include diphtheria, pertussis, tetanus, right, polio, and the EPI promotes universal immunization. It's important the progress has been made during the vaccine development by completing clinical trials like Nabila Wasif was in charge of. The Bill and Melinda Gates Foundation supports very effective international health initiatives. They invest basically millions of dollars in vaccine development. And as I mentioned, a lot of those funds go to the leading edge laboratories in different European countries, primarily France, for vaccine development. But I do want to encourage you to continue to talk to the global health champions, email them. The list is part of this Unit 13, and I want to encourage you to join as a volunteer, or even when you finish your bachelor's degree as a paid employee for NGOs that work in developing countries. And don't be afraid to get on a plane and go to Mozambique, or there'll be a whole set of people that will help you settle in, and they'll be appreciative of your work. Because when you can say, I'm a health worker, of whatever your speciality is, you can be an engineer, you can be a business accountant. There are lots of different people besides nurses and doctors who work in the international arena, including myself, working in public health my 40-year career. So you can say with pride that I am a health worker saving lives. And these are some examples of people that are saving lives. And this person is a more mature professional. You can see he's working in Panama. I thought they would be good examples. I'm a health worker saving lives. So I would like you to watch the video. These are people that have committed time, so maybe not their entire career, but they are committed time to work in international locations to serve people that are desperately in need of help, including Chelsea Bean here. So she got a fellowship from the Centers for Disease Control, and she's completed her master's degree in public health. She's working in, looks like South Africa, from the hut that's here. Let's look at our class discussion. So these will be your assignments, and I'm hoping to have a discussion forum this time where you're actually exchanging information. So discuss the public health challenges of the implementation of a universal immunization, because just the massive numbers of children. I mean, even being assigned to do immunization in China. Remember, 1.3 billion people, probably half of those, it may be as many as half of those are children. I mean, it's just mind-boggling, the logistics of the vans, the refrigeration for the vaccines, how to actually physically reach these communities. So again, the public health challenges, examine potential benefits of global application of the extended, expanded program for immunization. So worldwide eradication of commonly found infectious disease. Review professional activities for public health professionals. These are our global health champions. If you want to write a summary or do a little reading about Tom Ritchie or Diane Moroff or Molly Houtrich has helped students before in the past. We have other global health champions, Harshit Sanghvi. He's really busy, but you can still find a lot of information about these people online. Just type their name in and Google them. I think you will be inspired by their examples. And discuss the progress with vaccine development for HIV and malaria. And malaria in particular, Tom Ritchie, the challenge is that it's a very complex, big parasite rather than HIV that is a virus, which is very small. So the complexity of developing a vaccine for something that's bigger is harder. So again, these are places where you might be delivering, they're helping deliver bed nets for prevention of malaria. We want to just watch this video. There are others, but this one's very short.
I'm a health worker.
I am a health worker.
Nilipenda kuwa mhudumu wa afya sababu ya kuona matatizo mengi katika jamii, hasa upande wa magonjwa, sehemu ya kina mama na watoto wadogo.
Ma mère aussi est infirmière. J'ai envié beaucoup cette profession. Oh, I love mothers. I really love delivering these babies and make mothers comfortable.
Because I love my job, I like to save my patient's life.
Decidimos ser trabajadores del sector salud porque teníamos mucho interés en mejorar la salud pública de Panamá y específicamente en lo que era en prevención de enfermedades.
I like it because when saving people's life is something so important, because life is very important. It is not, you cannot buy it.
Ce que j'aime, c'est que, vous voyez, comme je n'occupe que de personnes vivant avec le VIH, ce sont des gens au départ qui ont un certain désespoir, qui ont perdu pratiquement l'espoir de vivre. Et peut-être grâce au conseil, grâce à l'accompagnement que nous leur faisons, au fur et à mesure, nous voyons des gens qui partent du désespoir à l'espoir. Et ça, c'est quelque chose de bien beau.
If I could have more training and specialize in a certain field and have more mentorship by more senior experienced doctors, I think I can be better. Of course, if I have time to upgrade my knowledge or get some training, more training, and then I'm sure that I can get better service to my patient and save more life as well.
Nous ne sommes pas des dieux, mais souvent on redonne encore cet espoir-là.
Okay, well, let me hear from you on the discussion board and the assignments, and we'll see you for the next unit. Thanks. Bye.